We're here on the Amazon River where we're going to visit a fever clinic. Cases of dengue in the Americas have surged to all-time highs. But the dengue outbreak isn't the only reason we're here. If a person has a fever and dengue isn't behind it, well, what is?
Here at the Amazon, it's really a highway. So it's one of our sites where we collect samples from patients.
This is Jorge Osorio and Juan Pablo Hernandez, whose teams span across Colombia, from the depths of the Amazon rainforest to around the Darien Gap, a treacherous migration route connecting Central and South America. They're looking for mysterious illnesses to try and identify unknown viruses. Work that could stop the next pandemic in its tracks.
What we want to do is to do a surveillance, an active surveillance of infectious diseases, try to realize what is circulating, what is emerging in our country. We characterize those pathogens completely.
The samples collected by the research teams are transported here to La Universidad Nacional in Medellin. Some machines enable identification of existing pathogens to learn how they're mutating. Others sift through genetic material to discover new threats. The data is gold because it can be used to develop diagnostics. It can also be shared with local officials and health providers in Colombia to inform patient care and the public health response.
One of the issues that we have post-pandemic was the lack of access to diagnosis, lack of access to vaccines. What we are doing with the Abbott Pandemic Defense Coalition is really preparing us better to respond to the next pandemic.
Climate change is leading to volatile weather conditions that favor mosquitoes, the deadly carriers of life-threatening diseases like dengue, Zika, and malaria. Across South America right now, mosquito repellent is flying off the shelves.
El efecto que tiene el cambio climático en nuestro país es muy grave, ya que aumentaron los casos de enfermedad febril debido a que pueden aumentar también las zonas de dispersión de los mosquitos y de los vectores que causan esas enfermedades febriles.
While Latin America, Africa, and parts of Asia currently bear the brunt of climate-amplified diseases, places like the United States are increasingly vulnerable. That's not just due to warmer temperatures, but also population growth, globalization, and migration. A virus knows no borders, which makes the work to identify unknown pathogens critical to all of us.